Hello everyone! Welcome to our first video of our Let's Learn About It playlist. Today, we're going to be talking about the coronavirus, specifically dispelling rumors and myths about the disease. Then, we're going to give you some up-to-date information on the illness, and finally, some tips to keep you safe. Let's start with seeing what information is true or false. I'm going to put a statement on the screen and you tell yourself in your mind if it's true or false. Now, I'm going to give you a few seconds to think and see if these statements are true or false. Coronavirus is the same as the flu. It's false. The flu and coronavirus are caused by totally different viruses and can have different long-term effects on the body. While some of the symptoms may be similar, including fever, cough, shortness of breath, difficulty breathing, and more, which we'll go over later on, symptoms that are unique to the coronavirus include a change in or loss of taste or smell. In addition, a person typically develops symptoms from coronavirus 5 days after being infected, sometimes as soon as 2 days or as far as 14 days after the infection. The flu typically shows up 1 to 4 days after infection. However, if someone has the coronavirus, they can be infectious, meaning they can give it to others much longer than if they had the flu. So it's very important to note that with the coronavirus, people can infect or give it to others, even if they don't have any symptoms. We'll talk about this more later. How about this? Children are immune to coronavirus. It is also false. There's a lot that unfortunately our scientists still don't know about how the coronavirus impacts kids. But what we do know is that children are not immune. They can still be infected. So far, most children have tended to have a milder impact from the disease. However, some children have developed very serious complications from the disease. And remember when I said that people can infect others even if they don't have symptoms? That's one of the biggest concerns for children getting infected. They can pass it along to older siblings, parents, grandparents, or teachers without even knowing about it. Again, true or false? Sunlight can kill the coronavirus. This is also false. There are a lot of myths about what can cure the coronavirus. There is misinformation about everything from sunlight to very dangerously injecting bleach. A lot of these false recommendations simply don't work and are very dangerous. For example, injecting or drinking bleach could kill you and is not a way to cure coronavirus. There are many traditional medicines that you may also hear recommended around the community, but these have not been tested yet. Scientists and doctors are working hard to develop a vaccine that will prevent people from getting infected. Until then, if you're sick, talking to a doctor is the best way to learn about treatments that might help you feel better. We'll talk about this more later too. Now that we've talked about what we know is not true, let's talk about what we do know about coronavirus. Coronavirus is a type of virus that leads to the disease COVID-19, which simply stands for Coronavirus Disease 2019. People can be infected with coronavirus without displaying any symptoms. However, even if they don't have symptoms, they can still infect other people. So this virus is highly infectious. This virus is very easily spread through the breath. That's why people are recommended to stay 6 feet or 2 meters apart from each other and to wear masks. This virus is most dangerous for elderly and anyone with an underlying health condition. Elderly people are particularly at risk from serious complications from the disease, including death. And when we say underlying health conditions, it can mean diseases like diabetes, heart disease, hypertension, cancer, or poor immune systems. Now, let's see what we know about coronavirus in St. Louis. The state of Missouri is currently listed as a red zone. This means that our state has too many people who are testing positive. Wearing a mask is mandatory in public where social distancing is not available. If you get tested for coronavirus, you must self-isolate until you receive a negative result. There are some limitations on gatherings, and no more than 50 people can gather in a closed space. Many businesses can only have 25% occupancy, and many late bars and businesses can stay open only to 10 p.m. Now, let's take a look at coronavirus's symptoms. This virus's symptoms can include fever or feeling feverish/chills. A fever is a temperature of 100.4 degrees or more in Fahrenheit or 38 degrees or more in Celsius. Anything over 103.1 Fahrenheit or 39.5 Celsius is considered a high fever. An average temperature is 98.6 degrees in Fahrenheit or 37 Celsius. Other symptoms can be cough, shortness of breath or difficulty breathing, change or loss of taste or smell, fatigue or feeling tired, sore throat, runny or stuffy nose, having pain in muscles or body aches, having headaches. Some people may have vomiting and diarrhea, although this is more common in children than adults. With all that being said, now we want to see how you should protect yourself and other people. First of all, practice. Practice physical and social distancing, which means staying 6 feet or 2 meters away from other people. And avoid large gatherings. Second of all, wear a mask or face covering and goggles or face shields. These instruments will help you protect yourself and other people. Also, if you're going to grocery shopping, remember to wear disposal gloves. Wash your hands frequently and remember to do it properly. When we say wash your hands properly, that means it should last at least 20 seconds and it must be with soap and water. If you do not have access to soap and water, use hand sanitizers with at least 60% alcohol. Remember to monitor yourself daily and weekly. You can look for symptoms such as fever, headaches, and all the symptoms that we mentioned in the previous slide. And finally, call your doctor and get tested if you have symptoms. Now, I recommend you to ask yourself this question. Is my employer providing the necessary equipment to stay safe while I'm working? In this part, we want to see how to safely wear face masks. First of all, why do we even need to wear masks? Well, the answer is very simple, because wearing masks helps protect other people. First of all, wash your hands before putting on your face covering. Second, put it over your nose and mouth and secure it under your chin. Then, try to fit it snugly against the sides of your face. And last, make sure you can breathe easily. There are also some things that you shouldn't do while using face masks. For example, you shouldn't place a mask on a child who's younger than 2 years old. Do not put the covering around your neck or up on your forehead. The mask is supposed to cover your mouth and nose in order to prevent spreading respiratory droplets. Do not touch the face covering, and if you do, remember to clean your hands. Now, we want to see how you should safely take your masks off. First of all, untie the strings behind your head or stretch the ear loops. Remember to handle only by the ear loops or ties. Then, fold outside corners together and place covering in the washing machine. Wash your hands with soap and water. As I mentioned earlier, monitoring for coronavirus symptoms can be very helpful. You can ask yourself questions such as, am I frequently coughing? Am I feeling tired? Do I have noticeable pain in my muscles? These questions can help you monitor your symptoms. You can also use other techniques such as making a point to test your smell and taste. Smell the flour, for example, or ask, does my favorite dish taste the same? Body temperature and checking on yourself to see if you have a fever is also another way. If you have your thermometer close to you, pull it out and let's practice together. Remember, always clean and sanitize your thermometer after and before every time you use it. Take a soft cloth, saturated with alcohol, and clean the metallic area which will be placed in your mouth shortly. If you don't have alcohol, wash the tip with cold water and soap. Push the bottom on the face of the digital thermometer. It will click. Place it deep under your thumb and wait for it around 1 minute. After you hear it several times beeping, it means it is showing your body temperature. Now, remember, if there is an F sign blinking, that means it is showing you the degree in Fahrenheit. And if it was a C sign blinking, it is in Celsius. As we saw in the symptoms slide, a fever is a temperature of 100.4 degrees or more in Fahrenheit, or 38 degrees or more in Celsius. You can also check your heat by placing it under your arm, but note that this might be with 1 degree Fahrenheit error less than the true temperature. And always know that the average temperature of a human body is 98.6 degrees Fahrenheit and 37 degrees Celsius. In our last part, we want to explain how to seek help. First of all, call your doctor. There are many ways to get help, but first and foremost, contacting your family doctor and listening to their recommendations are always prior. Sometimes this will involve a recommendation to get tested or a recommend to self-isolate or quarantine. They will provide more instructions for what that means. Contact your caseworker if having difficulty accessing the doctor. There are 2 hotlines. If you're living in St. Louis City, all you need to do is to call 314-657-1499. They're responding between 8 a.m. to 10 p.m. And if English is your second language, you can ask for an interpreter. If you live in the St. Louis County area, call 314-614-2660, press 2, wait, and ask for an interpreter. Thank you so much for watching this video today. Please watch our next videos for more information on how to stay safe in a large family household, precautions to take if a family member falls ill, and what you can do if you're high risk. Let us know if there are other topics you'd like to hear about.